eNCA's Zikhona Tshona joins us now and will be in conversation with the man leading that giant medical institution. All right, Zikhona, good afternoon to you. Are you with us? All right, we'll...
Yes, Jeremy,
yes,
I am outside Hani, Baragwanath Hospital, the biggest hospital in Africa and the third largest in the world. It looks after about 2,000 patients on the daily, so you can just imagine how busy this hospital is and how busy the acting CEO, Dr. Sifiso Maseko, is. So I'm very lucky and very fortunate to have him here with us. Doctor, people are not painting a very good picture of this hospital. What's happening inside there?
Thank you very much, Zikhona. I think you've stolen my introduction. It's the biggest hospital with over inpatients. We've got about 2,659 active beds of 2,800. So at any given point in time, we have over 2,000 inpatients. We do over 300 admissions, and the follow-up clinic has got over 2,000 patients. So you can see that on daily basis we have over 3,000 patients, one which will go to our emergency facilities, which will be your maternity, will be your peds, will be your accident and emergency, and then will be your trauma, and with the follow-up clinic within that. So it's quite then difficult to say that there's hardly any activity with such number of patients. At any given point in time, Monday to Thursday, we've got within the facility spread about 5,000 cars that we have to look after. We have, in terms of the staff complement of this facility, over 6,000 staff. To be exact, end of Feb, it was 6,318 staff members that at any given point in time they'll have to find themselves inside. So it's quite really difficult and challenging to say there's hardly anything when there's within that the service.
That maternity ward, a lot of medical negligence claims coming out of the maternity ward. What would you say is the contributing factor to that? What are the challenges you are facing as a hospital in terms of delivering this service?
Yeah, I think we need to understand it in context. We are the biggest facility in terms of deliveries in Africa. Previously, we used to deliver over 23,000 babies annually. And really, if we were to check, you will see that the next in line is relatively around 12,000 annually. So we are by far in terms of that. And that has not really come down, even with the existing other facilities trying to take the load, because the population is increasing. There's in-migration, Gauteng is it, and we've got undocumented residents that also access the facilities. So really, when we think about it, we've got almost 1,900 deliveries per month, of which of those deliveries, about 40% is by cesarean section. And yes, it is true then that you will have some, I wouldn't call it negligence, or unfortunate circumstances in terms of outcomes. And yes, then they will exercise their rights. So the negligence, and if you looked at them, those are negligence that are far back as 10 years and 12 years ago. And the facilities over that, you can go to any industries and you'll find that we've really improved when you look in the context of the number of deliveries vis-a-vis the number of the unfortunate outcomes.
You've mentioned the numbers in terms of the patients, in terms of the staff. Are you adequately staffed, adequately equipped for the kind of service that you do provide?
We can always do it more. But what is then important is to say, we're also trying to work within what we have been budgeted. Historically, the facility, we will say that maybe it was not in terms of the staff, but we are trying to really define the service and say with the staff that we have, this is so much that we can be able to do. But constitutionally, we can't then deny any patient accessing of the service. I fully agree with you, yes, to say, yes, it's true. If we're to be able, if we're to do a full analysis, you'll find that we can be able to have more of staff so that we are able to deal with that. But it's a
patients that we've spoken to that were coming out of the hospital saying after 11 it's very hard to access a doctor. At sometimes they have to come in here very early and stand for very long hours in queues. Your reaction to that?
I think what is quite clear is that we have moved to accommodate in terms of patients coming in. Our services, especially in patient registration, now they start around 6:15, even in pharmacy for their repeats. And we've also encouraged patients to say we'd like them to, one, adhere to their booking dates, but two, to be here in the morning, not at 4 a.m. At least if they can be here by 6:15 when we've got the services that are running. If we were to come around 9, you'll find that most of the patients that have been seen have already been serviced and they are already in their respective clinics. And the doctors as well. We've encouraged, and doctors in most of the clinics, they start as early as 8 o'clock. So we find it's very much unfair if you come around 1 when we've already planned for the services that we'll be able to. Some clinics on a very bad day can have up to 300 patients just to be service within the clinic. The clinics in particular that we could be talking about is the medical outpatient clinic, which is a follow-up, is the rheumatology clinic. Those are the ENT clinics. Those are the clinics that have got the biggest load of patients.
Thank you, sir. I know that you do have another arrangement. I'm not going to hold you on for much longer. That's the man in charge of this hospital, Jeremy, Dr. Sifiso Maseko, who says basically that as a hospital they could accept more help, they could accept more funding. They do know that they should be doing better for the people of this country, but not really admitting much wrongdoing on the part of those medical negligence claims that we do know come from this hospital, and a lot of them come from this hospital.
All right, Zikhona, Tshona, thank you very much indeed. All part of our big focus on public health here.